Hey everyone. So before I get my interview, I just want to let you know about our new gut brain health community called Wired for Healing. If you guys are stuck in your progress trying to fix your gut health, this might be the community for you. We have awesome support. We have 5 live classes per week. And if you guys are interested, I'm going to link down below in the description, 10% off your first month. So if you guys want to check out, you go limbic-training.com. You go on the website, you could sign up on there, or you could email us at limbictraining@gmail.com. Thanks so much, guys. All right, guys. So this is an interview I've really been looking forward to. I have Dr. Bruce Hoffman on with me today. And Dr. Hoffman, I just want to thank you so much. I was wondering if you could start by just introducing yourself and give us a little bit about your background.
Oh, sure. Well, I'm a physician in Calgary, Canada, Alberta, Canada, and I run a center called the Hoffman Center for Integrative Medicine, and I treat complex illness, multi-system, multi-symptom illness with a variety of modalities. And I use the model I've developed called the 7 stages to health and transformation as a diagnostic and therapeutic roadmap as to where, once you're faced with the patient's complexity, where should you place your diagnostic and therapeutic inputs that will yield the greatest healing results? Because sometimes people will present with mast cell activation syndrome, SIBO, blah, blah, blah. But that's really not the issue. The issue is their early developmental trauma and the estrangements from their parents and the fact that their whole system is shut down because they're not, because they're dealing with chronic adverse effects from estrangement from their life force. And so you have to sort of diagnostically work out where the most therapeutic benefit will be. And so that's what I do day to day, see complex patients.
Yeah, so I'd like to get into those multi-layers of healing that you talk about. But one thing I really want to specifically focus on, at least for now, is mast cell activation syndrome, because I've listened to a lot of your talks and you seem to know a great deal about that. Can you tell us what exactly mast cell activation syndrome is and how does that come about?
Well, mast cell activation syndrome it's a heterogeneous group of illnesses or symptoms, so to speak, which result from the mast cells, which are a type of white cell, being overactive. And mast cells have a specific purpose in life to keep you from being overwhelmed by the incoming triggers of environmental and mental toxicity. And when they get activated, and they're in many organs in your body, they're in your skin, they're in your gut, they're in your brain, they're in your heart, they're in your joints. When they get activated, they release 1,000 mediators of inflammation, not just allergy, not just histamine. So people get confused between histamine intolerance and mast cell activation. And when mast cells get activated, they release these 1,000 mediators of inflammation, which can cause all sorts of symptoms in multiple systems in the body. And so patients who have mast cell activation syndrome can present with a wide array of symptoms. And they typically, because our traditional medical training is very organ specific, you got one organ, one specialist, they end up going to 15 specialists and nobody puts the puzzle together that it's one condition. It's mast cell activation syndrome. But again, mast cell activation syndrome isn't really a diagnosis that stands alone. It's a result of multiple incoming triggers, antecedents, things that trigger the mast cells. And the task of an integrative physician is to figure out as many of the triggers as possible in a hierarchical way so that you can intervene therapeutically. So these are a group of people with multiple symptoms in many different organ systems, potentially. Yeah.
Do you think for somebody who deals with mast cell activation syndrome for a prolonged period of time, is that usually rooted in leaky gut, or what sort of disease states are manifest in MCAS?
Well, because the gut is so richly innervated with mast cells, very often, it's very seldom they don't have gut symptoms. But they may have all sorts of other symptoms as well: cognitive symptoms, brain fog, anxiety, mood disorders, panic attacks, cardiovascular symptoms, palpitations, angina, costochondritis, joint pain, wound healing disorders. Every system in the body can be affected. But it's very seldom that you don't get some form of gut involvement. So you most often see it manifested in some sort of gut issue, whether it be gut permeability or dysbiosis or GERD or, IBS or whatever you want to label you want to give it. It's very seldom that there's not a gut issue that's involved.
And what came first, the chicken or the egg with that? Is mast cell a result of something like SIBO, or does mast cell actually cause SIBO?
It's both, actually.
Okay.
It is the chicken and the egg simultaneously. Yeah, it's quite peculiar because the people with mast cell activation syndrome, they usually they'll have a particular trigger that blows them up and they get symptomatic. It's sort of, I got the flu, or I went to Mexico and ate wrong food, or I got a parasite. So, but if you go back in the history, you often will see that over their lifetime, they've had hints of mast cell activation, like rashes and wheezing when they exercise, and headaches that can't be explained, or anxiety that can't be explained through psychological means only. So you'll see the sort of harbingers of the condition. Then usually the biggest one is mold exposure, as you probably know. Mold is a tremendous trigger of mast cell activation. But I would also say that early developmental trauma is equal to mold as a huge trigger of mast cell activation. So yeah, there's usually been there before, and then they just have one or two triggers that just exceed their homeostatic mechanism's capacity to regulate the system, and they blow. They collapse. They get multiple manifestations of mast cell activation.
You mentioned earlier that there's over 1,000 mediators involved with mast cell activation. Of course, everyone knows about the histamine component. It seems like that's the one that people mostly talk about. Is that what sort of brings about most of the symptomology for people with mast cell activation? Is it mostly the histamine component?
You'll most often find that histamines involved to some degree, but there can be prostaglandins, prostaglandins which cause all of the pain syndromes. So you can get prostaglandins being emitted. You can get heparin. You can get heparin problems with bleeding and poor wound healing. You can get leukotrienes with a lot of asthma, like vasoconstriction symptoms. There's so many mediators of inflammation that can trigger such a variety of symptoms. But in my experience, histaminic symptoms usually sort of are the most front and center. And they can be IgE or non-IgE mediated. IgE is the antibody that's upregulated in so-called true allergies. And IgE, when triggered by grass or cats or dogs, attaches to mast cells and lets out a whole host of inflammatory mediators. But some people don't have an IgE mediated burst of histamine. They can have a non-IgE burst of histamine. Say just from histaminic foods, you can trigger the mast cell burst without going through the IgE antibody. So when people go to an allergist, they go, "Oh, they tested me for allergies. I'm not allergic to anything." Well, sure, you may not be, but you can have traumatic histamine symptoms and not be IgE allergic, because allergists only test for IgE. They don't test for all the other pathways of food activation or dysregulation.
I have to just ask this question just from my own experience, because I know you've talked about interstitial cystitis before. I've suffered with chronic pelvic pain syndrome for over 20 years. And a lot of people in the sort of mast cell experts seem to imply that these conditions are a direct result from mast cell activation. Is that something you agree with?
Yes and no. The chronic pelvic pain syndromes are very complex. And there's many, many reasons for chronic pelvic pain syndromes. people with tethered cords and ehlers-danlos and all the other categories. So I would hate to say it's just mast cell activation. It could be oxalates. There's so many variables. I'm just beginning to get acquainted with the pelvic pain syndromes, and I thought I knew quite a bit, but this is a whole nother area. And there's only a few people in the world that kind of know this stuff, you know. And fortunately, on my chat group, I'm on Dr. Afrin's chat group, there are specialists in pelvic pain syndromes who post from time to time. But I'm wading through literature this thick on just pelvic pain syndromes, and it's not just mast cell activation. That's the simplicity that it can be, but I'm not. It's so more complex than that.
Right. I could just tell you that I've really looked into the oxalate component of that. I know that's a huge component of it, but I was just curious as to how much of a component mast cell activation. But like you said, it's a very complicated issue. So
mast cells can definitely play a role. I mean, it's lovely when you find a pure mast cell or, you know, oxalate issue creating all the pelvic pain. But you know, we even do things like put Benadryl douches into, you know, vaginal douches for women with chronic pelvic pain syndromes and endometriosis with sometimes dramatic success. But there's so much more to it. There's all this venous drainage, and it's complex, man.
Yeah. So I know that getting diagnosed with mast cell activation isn't quite an easy task. Can you speak to that a little bit? Is it worthwhile doing tests for it, and what do you recommend on that end?
Yeah. So, you know, there's the different diagnostic criteria for the diagnosis. There's the old school criteria, the sort of consensus one, which means you've got to have all that tryptase elevation. But we don't. I work with Afrin's group with consensus 2, which is you just need a constellation of symptoms and a response to treatment. And if you're lucky, you got 2 positive lab tests. So we always like to try and get positive labs, but it's very difficult to get positive labs. You have to be in a sort of a flare to get them. And in Canada, where I am now, they only will do about 5 out of the 10 tests. And you have to have them refrigerated. So you've got to collect them refrigerated. You've got to spin them in refrigerated centrifuges, and you've got to ship them overnight. So the whole diagnostic criteria is quite complicated. And so you don't get a huge yield diagnostically. So I tend to go off symptoms and response to treatment. I have a high index of suspicion. So when I have a high index of suspicion, I get people to fill out Dr. Afrin's questionnaire. It's on the, if you go onto my blogs and my cell there, we include the questionnaire and get people to circle within each organ system what symptoms they may have. And sometimes you don't get many, you get 3 or 4, and sometimes you get 50 in each organ system. And then when you examine them, you get dermatographism, and many have ehlers-danlos as well. And then you can get the lab testing, but sometimes it doesn't yield very much. So I tend to downplay the diagnosis. Oh, there is one lab test which is very helpful though. It's the CD117 stain on mast cells in the GI tract. That test is usually very helpful because people will come in with chronic GI symptoms and they've been diagnosed with IBS-C or IBS-D or whatever, and they haven't responded to all the normal interventions. And then you get the CD117 stain for mast cells, and you'll see per high-powered field, there'll be 30, 40, 50 mast cells instead of, under 15 or 20, which is the cutoff criteria. But you've now recently seen a backlash by all the pathologists. When I've asked them to do the CD117 stain, they would for the first year or two. Now I'm getting this big backlash and say, we refuse to do it because the criteria for the diagnosis are not well established. And it's like medicine is always going 2 steps forward, 1 step back, and you're always fighting with the old guard and new guard. And the poor patients in the middle trying to figure that out. It's a problem.
I know that I myself and a lot of other people will just go to you're in Canada, so they go like a Dynacare and get a whole histamine blood test there, and mine always came up negative, and I'd always get frustrated because I knew I had histamine issues. So are those tests just pretty much useless?
Not really. I mean, in the Canadian system, I don't get a lot of we can do 5 in Canada. The one that usually shows up the most is chromogranin A. That one shows up more often than histamine and tryptase. Tryptase never shows up. I've had one case of tryptase in 10 years. You know, and that in consensus one, that's the one they want to see go up. It doesn't go up in mast cell. It goes up in systemic mastocytosis, which is the increased number of mast cells, not the increased activation. So chromogranin A is the one that you'll see high. You just got to be careful that the person who does the test isn't on a PPI, because the PPI will cause a false elevation in chromogranin A. They've got to be off it for 5 days.
Before we get into talking about treatments a little bit, can you just maybe give overview as to the most common symptoms that you typically see with somebody with MCAS? Is it mostly gut issues, sinus? I mean, what do you see on average?
Well, you get many of them have seasonal allergies. That's the most common. They'll have rhinitis, so their eyes will itch. They'll get skin rashes. They'll get hives. They'll get angioedema. That's a very common presentation. But then you get psychiatric symptoms. Many people have high anxiety. They have headaches. They have panic attacks, and they have insomnia and brain fog. So you get cognitive symptoms. Then you get joint pain. Joint pain is very common. Many different symptoms on the skin. You can get, urticaria pigmentosa. You can get, this is a specific mast cell condition. Hives, as I said, rashes, eczema. Even psoriasis can respond quite well to mast cell blockade. Then lung symptoms. Many people have wheezing, exercise-induced or otherwise. Cardiovascular palpitations, almost invariably linked to mast cell and the condition that often goes with it called POTS, postural orthostatic tachycardia syndrome. So you'll just see multiple symptoms in multiple organs. It's quite ubiquitous. It's uncanny how many symptoms they can be, but those are the most common ones.
Okay. And getting into, I guess, sort of, going the medical route and also getting into alternative treatments a little bit. Maybe we could just start actually with the limbic system, which we briefly mentioned earlier. Can you describe what the limbic system is and how that plays a role in sort of treatments or preventing us from being able to heal with this condition?
And I must say, in my experience, not everybody, but many people have developed early developmental trauma or had early developmental trauma that is unrecognized. And many of those people, when you do the heart rate variability test, you'll see their sympathetic system up in like 4 deviations above normal, and their parasympathetics 4 standard deviations below the peer group. So those people are in a sympathetic dominant state, and very often then tilt over into what is now known as Porges's dorsal vagal collapse. The ability to regulate is just lost, and these people are highly traumatized, highly sensitized, and are often given up hope. They just feel desperate. They can't climb out of their hole, And then that's also accompanied with dissociation and depression and suicidal thoughts. And then the biological companion to that is what we now know to be the cell danger response, which Robert Naveau has developed, where the mitochondria release all their DNA, and the DNA goes extracellular and stimulates mast cells, and you get this perpetuating destruction of mitochondria and ATP production. So these people are often very fatigued and often very desperate for some sort of recovery. And the amygdala is often the sort of point between the inner world of the person and the outer biochemistry. And so we do a lot of neurobiofeedback training. I send people to do Safe and Sound, Porges's Safe and Sound protocol. I get somatic experiencing practitioners to help build what's called a window of tolerance. Some people do Gupta's program, some do Annie Hopper's DNRS program. Some need a whole team just to hold that space for them while they start to self-regulate, because most of them can't take mast cell blockers. They would kick them out. Why? The thought of something else coming near them, which they don't trust, will trigger a mast cell response. It's a real response. It's not psychosomatic. It's not that. They will trigger a defense against any intrusion because they've learned to not trust anything coming towards them because they couldn't trust it for over 20 years of their life. It was not reliable. So there's a complexity to treating mast cell activation syndrome. It's not just give them mast cell blockers, not the people I see now. I wish it was that simple,
Yeah, I mean, speaking of the groups you're talking about, I mean, we have our own limbic system training community called Wired for Healing.
Yeah.
And one of the biggest problems that we've come across is that ego. It's not ego in the sense that people generally think of, but it's that sort of defense mechanism that comes up when you start talking about brain retraining and mindset training, and people think it's just kind of like nonsense to them. It just sounds like nonsense, and there's no way I'm going to get out of my sickness, by doing this type of thing. How would you overcome that? Is there any way that you found that really works to overcome that?
It's a complex subject, and it's only in the last 5 years that I can say I've approached it in a specific sort of way. After I learned about Porges's polyvagal theory in more depth and did a lot of work with Peter Levine in trauma, if the person doesn't establish a therapeutic alliance with the practitioner, forget about it. It's just not going to happen. But what creates the therapeutic alliance is salience. If you can demonstrate through objective data what's going on in their autonomic nervous system, what's going on in their brain, what's going on in the electrical activity in their brain, and their heart rate variability, and you can produce relevance and stories that reframe the narrative of their lives, I find that is the therapeutic input that really turns the case around. I also rely very heavily on a colleague of mine, Mark Wolin, who does family constellation therapy, where he looks at the inherited trauma up the generations, and he looks at for interrupted bonds and early developmental traumas. And he does a 2-hour session with most of my patients and gives them insights and homework to get them to regulate. But then they got to practice. Without the regulation, I have sort of given up trying to help people who are that shut down into the dorsal vagal response. Now, there's another interesting concept, is that many people, they are highly defended against anybody coming close. Now, you've got the Freudian first-line defense of projection and splitting, but then you've got this deeper defense that Helshed spoke about, which is the soul defense, where people are so sensitized and so vulnerable. There's no way you're going to get close to that person. And those you have to sort of leave, you got to respect that many often those people have personality disorders. They've sort of myelinated their brains so rigidly in one particular defense. They have high resistance and there's no penetration possible. But that's the exception rather than the rule. Most people, when you show them diagrammatically, here's how your internal dialogue is creating limbic upregulation, which then creates autonomic dysfunction, which then creates cell danger response, which then creates, if you can show them diagrammatically and spend time, I spend 2 hours teaching them the biochemistry and physiology and mental state of their condition. And that's the only way I can do it. If I just walked in with a prescription pad and put them on 4 mast cell blockers, forget about it. It's not going to work. It doesn't work.
Yeah. It's so interesting because a lot of people in our community, I oftentimes I'll ask them, well, what happened before you got sick? And they'll say that they had some kind of major trauma in their lives or some kind of massive stress that triggered their illness for them. Like they had a death in the family, a death of a husband or a son or something like that. And, it seems so obvious that trauma manifested in their illness, but they don't quite make that connection sometimes, right? And it's very hard to pull them out of that.
And often many of them have been in low-grade neglect trauma their whole life. Mother didn't see them. Dad didn't see them. Dad worked all day and mother was worried about dad working all day.
Right.
That's it. A lot of little
development.
hits on the limbic system that just accumulated, and then they get the big one,
Yeah, and then it's all downhill.
Downhill.
Yeah. So, okay.
One of the biggest triggers besides mold for mast cell activation.
I could believe it.
Which explains why benzos work.
Yeah, well, yeah, we need to get into that because I'm not a huge fan. But so talking about treatments, and we could talk about benzos as part of that.
Yeah.
Can we talk a little bit as to the prescriptions around mast cell activation in terms of just for Western conventional medicine?
Yeah, so there's a gradation of prescriptions. I never get to the real immune modulating drugs except for Xolair. But when I approach a patient with mast cell, regulation number one. If they're not regulating and practicing with M waves or safe and sound, or actually have a device that shows them when they're in coherence, the M wave or the inner balance heart math device, when you're in coherence between sympathetic parasympathetic, it goes green. Now that's this healing state. If you're out in the red in the sympathetic state, you can't regulate that system. So I always emphasize self-regulation strategies first. Then I always suggest that they look at the traumas second. Third, I look at diet. Diet is huge. People downplay diet, but don't. Diet is huge. You cannot treat a person who's eating inflammatory foods. It just doesn't work. Now,
can you speak to what that looks like a little bit? Like what kind of foods are we talking about?
Well, I've learned over the years to be pretty brutal with the diet. No 80-20 sort of nonsense. It's paleo autoimmune, low histamine, maybe low FODMAPs, maybe low oxalates, maybe carnivore. You got to see where that person's at, and you do all the food testing. Now people they slam food testing. They say it's false positives and all that. But when you start seeing a lot of food IgG, IgE antibodies, it does help you guide what therapies you're going to use. And if you do see SIBO and high FODMAPs foods and high oxalates, it guides you where you're going to go. So everybody's unique, personalized medicine, no one size fits all. But paleo autoimmune, low histamine, generally gets most of it done, sometimes not, but most of it done. Then you got the ones who are very specialized with, as I said, the oxalates and the salicylates and lectins. But generally 90% of the time, just cleaning up their diet with protein and fats gets a lot of the down-regulation of the inflammatory mediators. That's crucial. I work with a nutritionist/health chef called Justine Stenger, and she wrote a cookbook on this diet, and so we, without the diet piece, without the self-regulation piece, I don't even start to treat them. It's not going to work, And then once we get into the complexity of the treatments, you then got to dampen mast cell activation, because they can't take anything in. The mast cells are just nuts. So you got to try and do H1 blockers, H2 blockers, anti-leukotrienes, mast cell stabilizers, either nutraceuticals or pharmaceuticals. I have a preference for pharmaceuticals because they work. And nutraceuticals, everybody wants to be on a natural substance, and some people do better on them, but in my experience, if they can approach the pharmaceuticals from a sort of understanding and get them compounded without all the excipients and work with self-regulation, then they can hold these pharmaceuticals and then they work much better. Sometimes I bring people in to do intravenous mast cell work. Intravenous Benadryl, intravenous Ativan, intravenous Toradol, just to dampen the mast cell hyperactivity so they can tolerate the oral medications. But some people are so defended sometimes and so trigger happy that just the thought of taking a pharmaceutical causes a tremendous spiral. There's a lot of complexity and subtlety to treating it. So mast cell blockers, H1 blockers, I use ketotifen for nighttime. It's sedating. It's a first generation mast cell H1 blocker. It's antihistaminic, and it's said to be a mast cell stabilizer to some degree. And it's sedating. So anybody with insomnia, waking through the night, headaches, and mast cell symptoms, GI pain, that works beautifully. Ketotifen, yeah. And then I do the second generation H1 blocker. I tend to favor levocetirizine. And then the then the H2 blockers like famotidine, I tend to use quite a lot. That downregulates all the H2 receptors in the GI tract. And then often I use cromolyn. Cromolyn is a mast cell stabilizer like quercetin. And that sometimes is a game changer for some people. And then we go on to the anti-leukotriene drugs like Singulair. Those are the ones I tend to use most often. And with 95% of people being able to stabilize, provided they're self-regulating and their diet's clean.
Okay. Just speaking to diet just a little bit more, you mentioned protein and fat. Do people with mast cell activation have a big problem with carbohydrates?
Well, the carbohydrates that seem to be tolerated, provided they're not one of those subset oxalates, salicylate, tend to be some of the leafy green vegetables except spinach and except mushrooms. And then most of the root vegetables seem to be tolerated, except pumpkin appears to have slight histaminic properties, but it's mostly root vegetables, leafy green vegetables. But the key to treating a lot of mast cell patients, which is not well understood and not well emphasized, is repairing the cell membrane, repairing the gut lining, using a whole slew of things, including butyrate and glutathione being tricky because some people have a sulfur issue. Vitamin D is crucial, using phosphatidylcholine. Phosphatidylcholine is probably my go-to nutrient that helps regulate the cell membrane, the outer membrane and the inner membrane of the cell. And it's often in the dysregulation of the membrane that you get all of these problems with voltage of the cell and mitochondrial shutdown. We have a test now called the IGL test, which goes to Germany, which measures about 300 parameters of mitochondrial functioning. And we can look at phosphatidylcholine levels and phosphatidylethylamine levels and glutathione levels and all the toxins, the mold toxins, the chemicals, the metals, cell voltage. It's a brilliant test. So I look at those and then I determine which therapies to use. Of course, always treating gut first. Food gut, food gut, food gut, food gut. I mean, everybody's familiar with that by now, you know.
Hmm.
And the gut is complex because you get into all sorts of issues with the gut.
So would you say that the order of things then would be to, change the diet around and then sort of tackle the mast cell activation at the same time to bring symptoms down so that you could start treating other things like the gut?
Self-regulation trumps it all.
Self-regulation, okay.
Without that, I don't even begin. If they aren't practicing on a daily basis, 5-6 times a day to self-regulate in coherence, like really practice, that therapy is not going to hold.
So we're talking about like visualizations and different.
Using the M-Wave, using the device, the HeartMath device.
Oh, okay, right.
We use Borges's Safe and Sound headphones. We use brain tap. We use all different. We use neurobiofeedback home training. We get people to do remote training. We use vagal tone stimulators like the Resimax. There's a slew of devices, but we try and choose one or two depending on what the person's brain looks like. But unless that person's regulating their autonomic nervous system, there's that video, I don't know if you've seen it online, about the guy who rides his bicycle and he gets on stage and the bicycle, when he turns right, the bicycle goes left. Have you seen that video?
No, I haven't.
It's worth seeing. It takes him 9 months to learn how to shift his neuroplasticity so he can ride a back to front bicycle. And that's what many people have to do. They have to train, like you go to the gym and develop biceps, they have to train to self-regulate. Because that then holds the autonomic nervous system in, because you don't heal in an inflammatory, sympathetic, dominant, or shutdown state. You can only heal in a coherent state. If they're always in shutdown, if they're always in fight flight, it's impossible to regulate that system. So we get them regulating, clean up the diet, block mast cells, and then treat everything else. Many other things we treat.
Okay. And in terms of the medications you listed, so like I know that cromolyn is probably for more severe people, like is that the go-to if somebody has like gut issues as their main symptom, which is what I mostly talk about on my channel? Would cromolyn be the one that you would suggest if somebody has like SIBO, leaky gut, candida or whatever else?
No, those need other treatments. Cromolyn treats food reactivities.
Okay, right. Okay.
Yeah, and H2 blockers like famotidine block the histamine release from the gastric mucosa. So H2, famotidine, or Pepsid's over the counter, but it's filled with dyes and everything. So we get the compounded famotidine. That blocks GI histamine. And then cromolyn stabilizes the mast cell for those with 5 foods. But in my experience, people who come with 3 or 5 foods, you can't get them to take those things unless they've learned how to self-regulate and they've cleaned up their diet. It just won't do it. It's impossible.
Like they're too scared to try it? Is that what you mean? Or
they won't, if they've got amygdala upregulation and they're not regulated and their diet isn't clean, there's no way a mast cell blocker or mast cell stabilizer is going to change the outcome. Higher centers rule. The diet rules. Every time you eat, it's either pro or anti-inflammatory. So if you're eating an inflammatory diet, like I had a guy come in from Ontario who was eating tortillas, and he had olive oil and 2 or 3 other foods. He had 4 foods. He was like he was under 100. He was cachectic. He was malnourished. He had no fat. He had no protein, and he was fearful. He just, I can't eat anything. I can't take anything. Nothing's going to work.
Right.
We found out that his symptoms were triggered the day his father lost his career and the day he had a traumatic brain injury. He went into a spiral and hadn't been out for 6 years. Trauma triggered his symptoms. Salience is a cardinal feature of treating complex illness like that. Relevance. Why? Why am I doing this? Why am I doing limbic retraining? For what reason? What is the underlying entanglement of my unconscious that's creating this constellation of symptoms? You've got to make the unconscious conscious. You've got to give them homework. You've got to show them. Yeah.
So, okay, so this brings us into sort of a big rabbit hole here with benzodiazepines, which is something I want to talk about. Now, part of my channel is about discussing the dangers of benzodiazepines and other psychiatric medications. I could tell you, I myself, I think that I've been dealing with mast cell activation for a long time. and I probably had some degree of leaky gut. I've taken long rounds of antibiotics. I had chronic stress. I had a lot of other conditions. A restless leg syndrome for years, kidney stones, blah blah blah. So I've run the gamut, but I got put on a benzodiazepine to help with my chronic pelvic pain syndrome, and it worked wonders in the beginning. It did for a little while until I developed this sort of tolerance withdrawal, and then it started to work against me, and the pain started to get worse and worse.
Yeah.
And then when I withdrew from the medication, first off, I couldn't withdraw from the medication because every time I did, I got really, really ill.
Yeah.
And then when I did withdraw from the medication, it was a years long battle of absolute hell, like that I've never, it was basically felt like every symptom from every disease was thrown on me. And in that time, I've talked to so many people, literally hundreds of people through my channel that are going through the same thing, that they withdrew from benzodiazepines and they started getting rashes and they started getting the worst GI symptoms ever, and brain fog and anxiety and akathisia and sinus issues and stuff that they never really had before in great deal before the benzos. I've kind of come to the point now where I think that this long-term protracted benzodiazepine withdrawal is just mast cell activation. It's just mast cell activation times a billion. So I was wondering if you could speak to that, because I know that a lot of people do prescribe benzos as a mast cell, I guess, blocker or stabilizer. And so what is your theory as to why it is that people have such a huge problem with benzodiazepines when they're withdrawing and getting off that medication?
Yeah. So my understanding is, my experience is, and listening to Dr. Afrin talk at length on this subject, benzodiazepines have a dual role. They downregulate mast cell. On the receptor, there's a benzo receptor on the mast cell. So they're anti-mast cell. They suppress mast cell activation. They also have an effect on the GABA receptors in the central nervous system. So they reduce your cortical stress response. So you reduce stress, you reduce mast cell activation. And they work. Of course they work. The problem is with the dosing. So I don't know what dose you got up to, but generally the people on Afrin's group are very sort of, most of them anyway, not all of them, but are very traditional MDs, who are involved in chronic complex illness from real MD perspective. They use tiny doses of benzos, 0.625, like of alprazolam. And they usually find 1 to 2 times to sometimes 3 times dosing of those micro doses are enough to stabilize mast cells and the stress response. If you start going up on your dose over 1 milligram, if that's not working, they abandon benzos. It's just not, no more is not going to be better. And then there's also a question whether you use slow release or fast release. Like Xanax, quick acting, doesn't only in and out of your system too quickly. Alprazolam, clonazepam, a little bit longer acting, seem to be the drugs of choice. But when you stop them abruptly, you're going to get a flaring of your cortical trophic stress response, and you're going to get a flaring of mast cell activation. So that's what people deal with. I don't know what doses your members are taking, but if they are going up on dosing and they're exceeding, a milligram a day of, say, alprazolam or Ativan, that's going up and up on the dose is going to put them into real problem states.
Is there? I've seen this connection. I really think that a lot of people leading up to the benzo withdrawal had some kind of gut issues. A lot of people will explain in detail how they suffer from irritable bowel syndrome, or they had like acid reflux and they were on proton pump inhibitors and all this stuff leading up to that. So from my belief, there was probably why some people get this protracted syndrome and why some people don't is because there's some level of leaky gut or something as a root cause for their anxiety and other issues. And maybe they had some level of mast cell activation before they hopped on benzos. But when they get off the benzos, all hell breaks loose. Is there a reason why somebody would go through benzo withdrawal for like 5 years after they get off the drug? Is it not withdrawal per se, but is it because it could have some component to do with the mast cells, like the mast cells just become completely destabilized?
Because their mast cells have a benzo receptor on them, which they actually need. They are benzo receptor positive for mast cell. And so it's low dose benzo. It's like Athens' analogy is, if you put a person on antihypertensive medications, right, and they take them for life, you don't stop the antihypertensive, you give it twice a day. And if you don't give it, you're going to get hypertension. So with the Ativan thing, with the benzo story, and I don't mean to be, I'm not trying to sell benzos, just get me right on this one. But there's some people who seem to have, like some people respond to CBD as well because they got cannabinoid receptors on the mast cells. So it's just that they may need a low benzo in order to downregulate the receptor on the mast cell, or the benzo is activating the GABA receptor, which is calming their autonomic nervous system, which is flaring the mast cells. Now, I'd suggest those people do deep inner work to find out what's going on, because there's often, if they're upregulated HPA axis, they need to work on why the HPA, hypothalamic pituitary adrenal axis, is jacked up. And that's often trauma-based or some other reason, head injury-based.
Right.
So I'm not against benzos, but you got to be like, you learn how to use them judiciously, and you learn how to titrate them, and you learn how to say no and stop and help the patient through. Some people are only on 5 foods. They don't get better until you use benzos and calm down the IBS and calm down the sympathetic dominance and the parasympathetic shutdown. And they don't calm down the HPA cortisol receptors. They can go from 5 foods to 20 foods overnight sometimes.
Right. Are there any, you mentioned CBD, are there any other natural sort of mast cell stabilizers or things that could help people with mast cell activation syndrome? I know you mentioned quercetin. Are there, what do you mostly use in that realm? Do you work with alternative sort of supplements and stuff?
Yeah, sure. I use Histamine a lot, everybody's on that. And then we use quercetin. Quercetin is like cromolyn. I think cromolyn is actually made from quercetin. Theanine has tremendous benefits in some people. Curcumin, chamomile tea, resveratrol, and vitamin C from a non-citrus source, like from a rosehip source. That can be very helpful. Black cumin oil. We've got a very good source of black cumin oil from a company that's called Activated Products, very clean. But I find that when you start replenishing fatty acids, a lot of these symptoms downregulate, because a lot of these upregulated symptoms are because the cell membrane is twitchy. The cell membrane is not in a coherent state. There's deficiency of phospholipids on the outer membrane, phosphatidylethylalamine on the inner membrane, deficiency of magnesium, which is a calcium channel blocker. There may be a hyperreactivity to electromagnetic fields, which act to stimulate histamine like nobody's business in some susceptible patients. So you got to withdraw the foods, withdraw the EMFs, block, stabilize the cell membranes, repair the mitochondria, downregulate mast cells. And yeah, natural supplements are very helpful, but I tend to favor pharmaceutical. I'm an MD, so I favor pharmaceuticals. There's a bias because they work, they work. But some people always want to take pharmaceuticals.
Okay, so let's get into prognosis then, because you say that they work. So on average, I mean, can most people be helped with this condition? Because
Absolutely.
I know there are people who have been
Absolutely.
dealing with it for decades.
Absolutely. The only reason they're dealing with it for decades is because they haven't approached it at the right level of healing. They're working too much at food, gut. They haven't gone upstream looking at inherited trauma, defense structures, early developmental trauma, brain structure, autonomic nervous system, mitochondria. They're just working at the wrong level. That's all.
Okay. So what is like what is sort of the timeline for somebody that comes in? Let's say they have severe MCAS, maybe with like a histamine, mostly histamine component.
Yeah.
Is there like an average timeline that would take for someone just to even start seeing some improvements?
Yeah. So I always tell patients, like, how long, they always ask me, how long will it be before I get better? I say, well, I don't know, because I don't. But generally, to restore the cell danger response, to reset the autonomic nervous system, to create regulation, to deal with the inner work that needs to be done, it's about a year. But they should start feeling better, hopefully 4 months. They should be way ahead of the game. Now, I had a patient who's just gone back to England she came with 5 foods and with a cane and SIBO and reacting to everything. It took her 9 months. She just called me last week. She's doing fine. She's back to life. But it took her 9 months, and she had to do a lot of work around many issues. She had to deal with the death of her partner and all sorts of mold issues, very moldy environment that wasn't detoxed properly. But she was the longest, 9 months before she sort of turned the corner and went from 5 foods to everything. She eats everything now, except gluten. Most people should stay away from gluten because of this propensity to create gut permeability in everybody, not just those who have celiac disease. We all get permeability from gluten. Just some of us repair it much quicker than others.
Wow. So also part of my channel is about carnivore. Have you heard about anyone doing carnivore to cure this condition? I don't like to be dogmatic, but I know there could be a lot of different diets for different people.
Yeah, so sort of the end result is carnivore and then elemental diets, right? That's the end of the road.
End of the road for elimination diets. Yeah. I've been at both. Trust me. I
Well,
know I've been at
they're the
both.
J tube. You put a tube down. That's the end.
Do you have to go to that extent though to really heal? Like, do you see a lot of people healing eating rice or,
No,
eating? Okay.
no, you don't. You don't. You don't.
Okay.
No, you
So it's
don't.
like mostly we're talking vegetables, meat,
Meat, fish, chicken,
meat,
and
fish.
fat. Yes, therapeutic oils and fats. That's so. If I had to reflect on my career, the pieces that are missing are the inner work, the self-regulation, not enough emphasis on a strict diet, and the strict diet and the self-regulation. Those are the 2 pieces that really need to be like nailed, like really emphasized.
What if a lot of people I talk to are sensitive to fat, for instance, like say they have like really bad gastritis and they can't handle high fat foods. What can they turn to, do you think?
No, the people who can't handle high fat food are often those who've had cholecystectomies, their gallbladders removed, or who aren't producing enough bile.
Hmm.
They have bile stasis. And those people exist, yeah. And we use a lot of ox bile, TUTCA, lipase to help them. And we therapeutically introduce oils and fats while we titrating their enzymes, their fat digesting enzyme. And that
Okay.
can be interesting because sometimes they get fulminating diarrhea. And so there's a bit of a dance that goes, we get the calls, I got diarrhea. So we have a handout already prepared. If you got diarrhea, stop.
So you got to work your way up then with different foods and stuff until they tolerate it. And then you mentioned before talking about sort of there's a lot of different pillars to health, and you have these these multi-system layers that you work with and as a form of treatment. Can you speak a little bit more to that before we wrap things up?
Yeah, so I studied Ayurvedic medicine for a long time, and Ayurveda talks about layers or koshas, bodies, these levels of a human experience. And the external level is the world outside, and that in Western medicine, that's the world of toxicology. So level 1 or stage 1 is toxicology, chemicals, metals, infections, etc., etc. And then the second body or kosha is the biochemical world and the structural world. The world we know as MDs, the organ systems, or functional medicine, the systems biology. So that's biochemistry and pathophysiology and structural. So a lot of people need to go see nuclear chiropractors and do cranial sacral, all kinds of different therapies to regulate structure. And then the third level is the level of the brain, the central nervous system, the peripheral nervous system, and the autonomic nervous system, and its interface with man-made electromagnetic fields, and how that can get dysregulated, like dramatically. This 1% of the population have electromagnetic hypersensitivity syndrome, and they're truly shut down around EMFs. EMFs being electrical, magnetic, radio frequencies, and dirty electricity. So we send in building biologists to measure people's beds where they sleep and measure their body voltage and unplug things and create sleep sanctuaries and everything. And then in that level, we do QEEGs of the brain, and we look at the autonomic nervous system, heart rate variability, things that are regulated by that third level. The fourth level is everything to do with one's emotional content and early trauma. And that's where people have a lot of their content is in this dysregulation of the so-called emotional body. And then the fifth level is the level of ego development. So that's the mind and the intellect and one's values and one's beliefs and one's internal dialogue and one's defenses. Defenses being the key, because people are highly defended and won't let you in. You've got a problem on your hands. And we send them to specific therapists called ISTDP, where they unlock the defense structures to see what many people present with anxiety. Now you can get psychological anxiety and you can get body-based anxiety. Many people with mast cell activation have a 10+ anxiety. They like OCD even. You block mast cells, it's gone, 0. Because histamine is an excitotoxin. So level 5 is working with beliefs and values. And for that, we do a lot of different strategies. There's many of them. And then level 6 is the level of the family system and the personal unconscious, the so-called soul, if you will, from a Jungian perspective. And many people in the first half of life are very different from those in the second half of life. And often symptoms are teleological. They actually show up in order to point a person in the direction that they've been avoiding. And so you've got to be able to uncover the unconscious dynamics of that person's trajectory of their life history to see what they're not looking at, what they're not facing. Because anxiety is not, if it's psychologically based, it's not an emotion, it's a defense against a feeling. So often underneath all that is, shame, guilt, anger, rage, murderous rage that hasn't ever come out. They just get anxious. It's a defense. And so at that level 6, we work with the family soul and the personal soul and see who is this person sitting in front of me? What are they born to be? And I refuse to accept somebody as being all sick. I don't buy that. They've got another identity. They've got a creative sense of themselves. Who are they really? What are they here to do with this life, this precious life? Yes, they're identified as a patient and they've been struggling, but that's just because the right roadmap hasn't arrived. And they haven't been able to negotiate the layers and levels appropriately in a hierarchical manner. And I'm not saying I have the roadmap, but I just have developed a system of working with people to try and uncover the dynamics and the history and the story that needs to be rewritten. And sometimes it's not my cell. It's, it looks like my cell on level 2. It looks like chemical toxicity and heavy metals and mold, level 1, The brain's dysregulated, but you look upstream. I hate my father, I hate my mother, I haven't spoken to him for 10 years. That person will not heal. No. Because they half their mother, half their father, shut down their life force, they shut down their conduit to a bigger picture. There are many things. You find gurus and things, they bypass the parent and they go to, they get the good parent instead of the bad parent.
I know you said in Judy's interview that, because there's such a huge fear around omega-6 fatty acids. And we're so geared towards, just only looking at omega-3. We just want omega-3, and we're sort of taking these mega doses of omega-3. And you mentioned that is sort of the wrong way of going about things. Maybe you could just touch on that just quickly, maybe just a few minutes.
Yeah, well, I've done maybe 1,000, 2,000 fatty acid profiles. Very seldom do I find the omega-6 being through the roof and the omega-3s being deficient. Everybody I see is on omega-3s. And the omega-3 fats are sort of 3 standard deviations above normal. And those, when they're too high, shut down omega-6 production of phospholipids. So you need a 4:1, 6:3 ratio in your fats. You don't want to overdo fish oil. You just don't. And everybody's making it. I spend my life doing, taking people off fish oil and off fermented foods. Everybody's trying kombucha and kefir.
Right, to heal their gut. Yeah, and I've been there many times myself. Yeah. Doing the GAPS diet was not fun for me.
No, GAPS diet blows all my cell people through the roof. Yeah. So yeah, omega-3s are overrated. You need them. And you need to eat fish, but you could not eat fish that's, the whole histamine thing. They got to be freshly caught, flash frozen at source. And once they're defrosted, you got to eat them. You can't let them lie around for days.
Yeah. And speaking of, I guess, getting in, phosphatidylcholine as well, you mentioned, would you recommend more supplementation with that, or is that just more food-based? You recommend certain foods?
So I measure all of these. So I go off the levels in the phospholipids. I measure through the IGL test that goes to Germany. I measure the phosphatidylcholine, the phosphatidylethylamine, and the prodrome scan measures those, and the plasmalogens, which are the fats that are made through the peroxisomes in the cell to regulate inflammation. So I just measure everything. And then I mostly use nutraceuticals and fats in the diet. So people are pouring oils on their foods. Never cook with olive oil, never heat olive oil. That's a big mistake. And they're pouring all these oils and taking phosphatidylcholine out the bottle, using plasmalogens and repairing the mitochondria that way. And it works. It takes about 4 to 6 months. And the test goes from disastrous to normal in 6 months.
So interesting. We need to have a part 2 at some point, because there's so many different things we could just keep going for hours. I know you're a busy man, Dr. Hoffman. So I really appreciate your time. I highly suggest you guys really, really take a look at Dr. Hoffman's work. It's really compelling, and I've learned so much from you. So I really appreciate it.
I'm just publishing an article on POTS today, so it'll be out today or Monday. Part 1 of POTS. So POTS and mast cell and go together, and there's a lot going on there. So.
That's amazing. Well, we will definitely have to do a part 2. My favorite Canadian, Dr. Hoffman, thank you so much. I really appreciate it.
Oh, that was a great talk. Thanks very much.
Yeah.
Okay.